Alright, so I want to talk to you about the Thermi for the neck. The Thermi for the neck involves coming into our area and looking at your neck to assess it to make sure it's going to be a good candidate for that. Most patients have a lot of laxity or loose skin of the neck, maybe some fat. The Thermi can actually take care of all of that. The procedure involves coming into our room. We're going to take some pictures of your neck, of the area in different positions, and then we'll also have you sign a consent form going over the procedure itself. We will do marking of the procedure using a marker, which comes off after a few hours, and we will then lay you down on our bed behind us right here, and then we will do what's called a marking of your nerve. There's a little nerve right here that works on your smile. I want to make sure that we can isolate that and not have any issues with that in the future. Also, what we would do then at that time is start the process for numbing, which involves cleaning up the area. We use Blvd for that. And then after we clean you, then we take a small needle to do a small area right here on the side of the ear and under the chin as well to do some numbing. And then once we have that area numb, then we take a larger cannula, which will then take a small hole under the ear with a needle. You don't even see it after it heals up. And use that to place the numbing under the whole area. So a local anesthetic like you're getting tooth pulled. About 80 cc's to 100 cc's of fluid is placed in the neck. Give that a few minutes to get nice and numb to our machine, and it will then determine the temperature that we're going to use to treat your neck at. Most patients are getting treated anywhere from 55 degrees Celsius to 70 degrees Celsius. And the rationale is skin tightens anywhere from 45 to 55 degrees Celsius, and fat will be taken apart by the heat anywhere from 55 to 65 degrees Celsius. And we also see tightening of the collagen anywhere from 45 to 55 degrees as well. So we get the tightening effect. That will help with that. The entire procedure under the neck can take about 20 minutes to 45 minutes, just depending on the size of the neck we're treating. And once you're done with that procedure, it's relatively painless. And by the time we're done with that, you'll have some swelling. Most swelling occurs on the jawline or right below it. That swelling can be there for a few days to a week or so. It's hard to predict who gets the swelling or not. It just depends on how the rest of the treatment is. And then, once you're all done, we place you on a headband, and the headband goes around the neck. And once you have to wear that for about 1 or 2 days continuously to make sure we get some of the compression in the area that we're treating, we want to heal in that position. Now, it's not a necessity where 24 hours a day, if you need to go out and do something, you can take it off and do that. But the longer you wear it, the better. So we recommend about 2 days straight wearing it, and then also at nighttime for about a week. And then after that happens, you could have some bruising after the day or so. Most patients don't get a bruising. Swelling is the most common side effect of the procedure we see, but that means it's a good treatment. And after you stop wearing the headband, some patients like to wear a little bit longer if they have more loose skin. But it's really just to help push the skin up in place and get the healing process. And then we like to see patients back about a month just to make sure things are okay. And then we'll take pictures about 3 months and 6 months to see how you're doing. But other than that, it's a relatively painless procedure. Most of the patients that we have done the procedure said that they would do it again because it was relatively pain-free. And we're getting some good results.